Hei kaikille, mä oon Katja Puolakka ja mä toimin sekä Apple- että Barral Instituutin maajohtajana Suomessa. Ja tänään mulla on haastateltavana meidän seuraavan Viskeraalimanipulaatio 1-kurssin tuleva opettaja Kirstie Cousins. Hän on Englannista ja on osteopaatti, mutta mennään suoraan siihen haastatteluun, niin Kirstie saa vähän kertoa enemmän itsestään. Hi, Kirstie. Nice to meet you, and thank you for saying yes for the interview.
Lovely to meet you, Katja. I'm very happy to be here.
Likewise. So first, could you tell a little bit about yourself, who you are, and about your background?
I am an osteopath. I trained at the British School of Osteopathy in London, and I have been in practice for over 15 years. I came to osteopathy as a second or even third career after a more corporate start in life, and I came via I sort of explored soft tissue work with sports massage, etc., before I fully committed to osteopathy. I don't know what else, sorry.
So how did you end up the Barral Institute work and the visual manipulation, and how long you have been practicing that?
I became fascinated with visceral work as an undergraduate. We had some lectures from Dr. Stephen Sandler, from Caroline Stone, and from Renzo Molinari. And I started to understand how osteopathy might contribute to other conditions that were not necessarily musculoskeletal in presentation. So I started to understand a little bit more about fluid dynamics in the body and how some of the insidious complaints that our patients present us with might develop over time, and how taking a more complete approach to the body might help. So we had some classes with Stephen Sandler, undergraduate, for visceral osteopathy, and I was lucky enough that Jean-Pierre was also teaching in London at that time. So I started to study with Jean-Pierre before I'd even finished qualification as an osteopath.
That sounds interesting. And what I have understood is that you have a busy clinic. So how much of the work that you do with your clients is visual or other Barral that you have learned over the years from the Barral?
The trainings from the Barral Institute are very complete. So I use Barral work with almost every single client that walks through the door. Obviously, I started with the visceral work and progressed to the neural and manual articular work and some of the advanced classes. But one of the key tools that Barral gives us is using listening to the body as an assessment. And the techniques for listening and inhibition are invaluable with all of the patients that come through your door, because they help you as a practitioner to find where the body is struggling most on that day. So even if a client presents with an acute neck where they've slept in an awkward position, or a classic disc presentation, or the normal things that you would see as a local osteopath in any community, the listening techniques help you to understand how other parts of the body, not just the musculoskeletal system, contribute to the situation where that condition has arisen. So using those techniques that Barral has taught me helps me to filter what I'm going to do with that client, and then help me select which techniques that I want to use. Now, with chronic presentations, Jean-Pierre has found that 90% of chronic presentations have some kind of visceral involvement. So unless you're just treating people who've fallen off a ladder or who've sprained their ankle when they're out running, then taking into consideration the mobility of the whole body inside the musculoskeletal container, as well as the bones and muscles that we're really familiar with, helps you to be more efficient and more effective and get results quicker that last longer. So the more I've learned, the more I use. And I, hand on heart, would say I use listening on every single patient, even those people who've fallen off a ladder, because it helps me to work out. When I was taught osteopathy, we were looking for tissue causing symptoms, and we were looking for predisposing factors and maintaining factors for in order to help us develop our treatment plan. And listening is absolutely invaluable for that. And almost every patient that you see, there will be some visceral or neural involvement.
Yeah. And what type of clients do you usually have? Is there some specific group? I can imagine that it's really a big variety of people, but if there's any specific groups that come to your mind?
In honesty, I see myself as a general osteopath. I don't advertise myself as a specialist of any sort. However, I have a classic high street community practice and a little practice in central London. And so I will see anybody and everybody, and use this work with anybody and everybody. But as my skills have developed over the last 15 to 20 years, I get so many more referrals from other practitioners, and just word of mouth, being somebody who might have an approach for more difficult, complex or chronic conditions. I've got great relationships with some nutritionists who work a lot with SIBO. I work a lot with women's health and pelvic conditions, particularly the things that people have seen the medical profession, they've seen other practitioners, and the conditions are multifactorial, and people are struggling to find a way through. And those are the conditions I think osteopathy has something to contribute to, and the Barral work particularly, because listening helps you sift through where you need to work. And because we see the body in all of its systems, in terms of the blood flow, the lymphatics, the neural system, the musculoskeletal system, and we understand the anatomical relationships between those structures well, we have a lot to give in very complex conditions, in very complex situations. So I see post-operative, I see I see everybody and anybody.
Then if we talk a little bit about the upcoming class, the Visceral Manipulation one, what is it about? What will people learn in the first class?
Visceral Manipulation 1 concentrates on abdominal organs, and we cover the liver, the stomach, the duodenum, the jejunum, the large intestine. So we cover a lot of anatomy. We cover the understanding of how the organs develop within the peritoneum, within the body, and how we would expect them to be able to move against each other. We look at their relationships with the big blood vessels in the body, with the nervous system, and with the musculoskeletal framework of the body. We look a little at the physiology of all of the organs, so we understand their role in the body's health. Most people that take this class have never tried to palpate organs before. So we start off with the liver, which is lovely and big, and we explore palpation, because our palpation, our ability to differentiate certain structures with our hands, grows alongside our anatomical knowledge. So we will take time to find each organ and feel each organ and understand what the texture and what the feeling of each organ is in our hands. And then we'll look at how we can mobilize those organs in relationship to their normal physiological range of movement, so how we can assess them, and how we can improve the ability of those organs to move in the way in which they're meant to in the body, which can affect, because they're all contained within peritoneum, it can affect the blood flow and venous drainage of those organs and help their function a little bit too. So it's an exciting adventure in palpation. We will also we would also work a little bit with how the mobility of those organs can affect the body as a whole. So we'll see that, we'll talk about, and we'll see why, if somebody's presenting with right shoulder problems, that the liver may have an involvement in that. So it can be quite exciting in terms of the musculoskeletal effects of working with the organs. We will also do some exercises relating to listening and how to prioritize where you might want to treat within the body. So there's lots and lots of time to feel things, and that gives you hopefully the confidence to go out and use this work immediately in your clinical situations. So the aim of the class isn't, it's very practical, and it's to give you tools that you can use next week, like with the next patient that you see. So that's quite exciting, I think, as a practitioner.
Sounds like it, and a lot of information, but also a lot of practical exercises within the class in the 4 days. So how much people actually should know? Someone might think that, okay, they didn't teach that much in, let's say, the massage school or even the physios, that there might not have been that much about the anatomy and physiology of the internal organs. So
as long as you have got a background in body work and an appreciation of a fairly soft touch on the body, we learn the techniques along with the anatomy. And because we do an anatomical piece and a palpation piece and a technique piece, I think it really helps you learn the anatomy because you feel it in your hands. So there's, for me, when I was learning, there is nothing like feeling and palpation and mobilization to help you really get a great three-dimensional picture of the body, which really, I mean, it really helps with all of your techniques, all of your practice, whatever your background, to understand anatomy a little bit more in a really practical sense, can only improve your understanding of how the body works. So whatever your background, if you come with an open mind and a willingness to learn and a pair of hands, I think you will get a lot out of the class.
Sounds great. To whom do you recommend the class? Who should take it? If everyone is not the option.
Sorry, I didn't quite catch that.
Sorry. Yeah. So to whom, to whom you would recommend the class?
My background is osteopathy, and I am passionate about osteopathy. And my true belief is that if as an osteopath you want to treat the whole body, then then understanding these techniques is an integral part of osteopathy. That said, any body worker, so if you're a sports massage therapist, if you're a chiropractor, if you're a physiotherapist, particularly if you deal with, well, I mean, any body system, right? So if you're a respiratory physio, this is useful. If you're a cardiac physio, this is going to be useful. If you are a normal outpatient musculoskeletal physiotherapist, this is going to be useful. So anybody who sees people with, long-term presentations, or presentations where you treat people and they come back 6 months later and the same thing's developed again, this will give you another piece of the jigsaw to understanding how chronic conditions operate within the body, and more tools to help you improve your patients' lives. So craniosacral therapists, I mean, we've also had Feldenkrais practitioners on the classes. We've had in the UK, we've had some obstetric and gynecology consultants. We've seen general practitioners. It's an interesting class for a whole host of people.
Delighted. So hopefully we will meet as many people in the class and from different backgrounds, because that always brings so much to the class, as long as there is the manual therapy background. And so thank you, Kirstie, and it will be lovely to meet you in Finland soon.
I'm very excited to come to Finland. I'm looking forward to seeing you in February.
Thank you, and thank you for the interview.
You're very welcome.
Hei, kiitos kun katsoit tämän haastattelun, ja vielä kurssista sen verran tiedoksi, että meillä tulkataan kaikki kurssit, eli ei täydy myöskään jännittää sitä, että riittääkö englannin kielen taito, vaan myös suomeksi sitten löytyy, saa sen informaation ja opetuksen ja myös apua sitten kurssilla, ja toivottavasti tavataan Viskeraalimanipulaatio 1 kurssin merkeissä. Kiitos.